And Stanford Health physician Dr. Alok Patel for more on this. Dr. Patel, it feels like it's one thing after another. First, COVID itself, then the Delta variant. Now we have to worry about RSV. And as Eva pointed out, it can be hard to tell RSV apart from COVID. So what symptoms should parents be looking out for, and what do we do if we see them?
Morning, Diane. I think Eva really had a great Venn diagram there in talking about the similarities and the few differences. And one of the key differences, as we just saw, was that loss of smell or taste. But also, I think parents out there can think about the types of exposures their children are in. Is there someone in the family or someone else who hasn't been vaccinated, or were there exposures of cases around? And that's important to discern. But at the end of the day, the right thing to do is to take your child or anyone to see a healthcare professional and just get tested, because that honestly is the best way to kind of try to triage what you should do next. Do not try to self-diagnose this at home.
And the White House is saying now that vaccinations are up more than 200% in states hit hardest by the Delta variant. So where do you think those vaccination rates need to be before we start seeing cases start to fall again?
Well, Diane, you're trying to get me to do high school calculus right now, early in the morning. But basically, you know, yes, there is a silver lining to seeing the numbers going up. It's tragic that we're having to see them going up because people are seeing their friends and their neighbors in some of these states, especially Louisiana, getting hospitalized. Now, you know, I would rather push it back down to look at the percentages overall. We're a little bit more than 50% of this country fully vaccinated. We reached President Biden's goal about a month late of getting 70% of Americans with one shot. We need to be at about 80% of this country fully vaccinated to get close to that herd immunity. We will get some form of immunity from people getting naturally infected, but that's not the way we want to go, especially as we're seeing more people get hospitalized and hospitals getting crowded. And back to your early question, we are seeing a risk of that as well from things like RSV. Hospitals get crowded every year without the pandemic. So the surge on surge is a very real thing that's happening in many parts of the country.
Ian, heading into back to school season and heading into flu season, not good. In Louisiana, the governor has reinstated a statewide mask mandate. Do you think we can expect more of those to follow?
I think we can definitely expect a push for more of those, and we can expect more debates. I think we can definitely see more mask mandates as people are saying, like, hey, you know what? We have enough protection to not have a lockdown, but why don't we try to continue this progress towards reopening and getting back to some level of normalcy while preventing the spread? And that's what masks can really do. You know, we see these people protesting right now about mask mandates, especially in the school setting, but I wish people would take a step back and say, we're trying to prioritize keeping businesses and schools open. And so even though the debate's going to rage on, I think there will be a push to try to get those levels of mitigation out there until we get more people vaccinated.
And there is this thirst for normalcy still. I mean, people have been locked up for so long that this summer felt like, yay, we can finally do things again. So what's your advice to people who are thinking about going to something like a festival or a concert? Are certain precautions more important than others when it comes to assessing how safe it is?
Well, I'm one of those people who will be going yay and wanting to go out to a festival. And the most important thing anyone can do, surprise, surprise, is get vaccinated. Yes, you should bring a mask just in case you're in an indoor area or you're high risk or you live with someone who is. But you can also rely on things such as hand washing, surprise, surprise, and also ventilation with the outdoor space. But Diane, it's important to remember at the end of the day, even though we see these headlines about breakthrough infections, that the rate of people who are hospitalized right now or dying who are vaccinated is extremely low. It's like 0.001% for vaccinated people right now who are hospitalized with COVID. We saw the headlines about Provincetown, about 350 vaccinated people came down with COVID-19. But remember, there's projections that there were upwards of 50 to 60,000 people in that town. It's a very small number. So get vaccinated and try to live some level of your normal life. You earned it.
Do you think we should start focusing more on the hospitalizations number rather than the case number, given what you just said?
Absolutely. When it comes to vaccinated individuals, I think we should be focusing on, you know, symptomatic cases are important for people to understand, especially as we talk about the possibility of transmitting the virus if you're vaccinated. But in terms of how effective the vaccinations are, we should be focusing on hospitalizations and deaths. That's why those numbers that came out yesterday, reported on several news outlets from the Kaiser Family Foundation, was so important, because when people see breakthrough infections and they don't see any qualification, I'm hearing from patients saying, hey, vaccine doesn't work. What's the big deal? And in reality, it's working incredibly well.
And so I want to pick up on that because Senator Lindsey Graham, who is vaccinated, now says he's tested positive for COVID, and he was at an outdoor gathering on a boat with several other vaccinated senators. So in an environment like that, do we know how likely or unlikely it is for the virus to spread, assuming it is the Delta variant?
Well, we could say roughly that it's more likely to spread than the Alpha variant. Now, about a year ago when we were talking about the Alpha variant, yeah, there were certain metrics out there, such as 6 feet, and the amount of time you needed to be around someone to get an exposure. Those numbers are probably a little less now because we have a much more transmissible variant. And, we saw those studies saying there's almost 1,000 times more viral load in somebody who is carrying the virus. So you can absolutely spread it from person to person. You and I talked about this last week, and the PCR test could still pick up on that and say, hey, you're positive. But the important thing, again, is to remember that, yes, if you're in an outdoor setting with a more transmissible variant, you may still test positive, but you're a lot less likely to get a symptomatic or severe illness. That's what the take-home message should be. And I hope that's what these senators and these vaccinated individuals are still pushing people to do, because that's what we're going to do to protect people and keep these hospitals from getting crowded.
All right, Dr. Alok Patel, it's always great to have you. Thanks, Doc.
Dan, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.